Assalamualaikum. Today we are going to study about sternum and we will discuss about part, anatomical point, joint, attachment and relation of the sternum. First of all, this is the sternum. It has three parts: manubrium, body and xiphoid process. This is manubrium. Its anterior surface is flat, smooth and it's convex from side to side and concave from above downward. Its upper border is bold and thick and there is present a jugular notch at its center. Two articular facets present on each side and there is present one facet each side for costal cartilage. This is body of the sternum. Its anterior surface is nearly flat and smooth and it is divided by three transverse ridges. Its lower end is narrower than the upper end. There is present costal facets on each sides. This is xiphoid process. Now we are going to discuss about the joints which forms by the sternum. Sternum with clavicle make joint saddle type of synovial joints. Its movement is sliding and gliding. With fast costal cartilage, this make joint primary cartilaginous joint, and with second costal cartilage and further more costal cartilages, it makes plain type of synovial joint. Xiphi-sternal xiphoid process and the body of the sternum makes xiphi-sternal joint. It is secondary cartilaginous joint. We know that every joints, most of the joints are primary cartilaginous joints present in the midline, but this is secondary cartilaginous joint, which is articular surface is formed by articular surface is formed by fibrous cartilage and there is middle present hyaline cartilage. Now we are going to discuss about attachment of the sternum. In manubrium, there is anterior surface, posterior surface, lateral border and upper border. In anterior surface, there is attached sternocleidomastoid muscle and pectoralis major muscle. In posterior surface, at the level of the clavicle, here is attached clavicle, so here is attached sternohyoid, and at the level of the first costal cartilage or first costal there is attached sternothyroid. Its inferior surface is rough and makes sternal angle with the body of the sternum. This sternal angle is considered as the landmark of the counting ribs. Also here upper border is bold and thick, and here is bone marrow is collected for determination of many diseases like malaria, kalajor, etc. And here body of the sternum has pectoralis major muscle and pectoralis major muscle, anterior surface, lateral border, there is present external intercostal membrane and internal intercostal muscle. And xiphoid process, there is xiphoid process, anterior surface, posterior surface, lateral border. Here anterior surface, there is attached rectus abdominis muscle. There is lower end, there is attached linea alba, and a lateral border, there is aponeurosis of internal oblique and transversus abdominis muscle. And we are going to talk about relation of the sternum. At the level of the manubrium, there is in the lower part there is present arch of aorta, and upper part there is from right to left left brachiocephalic vein, brachiocephalic trunk, left common carotid artery, left subclavian artery. And body of the xiphoid process, posterior surface, right side is related with right border of the lung and the pleura. Left side is related upper to sternibri, is up to upper to sternibri. There is left border of the lung and the pleura, and lower to sternibri there is attached to the heart, is related to the heart. It is relation. And xiphoid process, a posterior surface is related to the left lobe of the liver. Thank you. And if you like my video, please subscribe to my channel.